Quality improvement techniques should be an integral part of routine work in order for healthcare professionals to constantly improve their services. However, at present, there appears to be only isolated examples of good practice. My name is Nargis, and I'll be taking you through a study where we took an innovative collaborative approach to develop a postgraduate quality improvement training module aimed at upskilling community pharmacists in QI methods. As pharmacists continue to extend their professional role and deliver new services, there's growing debate on how pharmacies can maintain service quality within a clinical governance framework. There's currently a lack of practical and coherent approaches to QI in both training and organizational culture, and little is known about how QI is contextualized and fostered within community pharmacy, or to what extent newly learned principles can be applied and demonstrated in practice. It was hypothesized that postgraduate quality improvement training that provided pharmacists with methodological training in the principles of QI could facilitate a positive change across a range of community pharmacy services. So, in collaboration with 4 local pharmaceutical committees, or LPCs, De Montfort University developed a quality improvement training module. For those unfamiliar with LPCs, these are responsible for designing, delivering, and commissioning health services in England. Focus groups were conducted before and after the training and were used to explore pharmacists' motivation to undertake the learning, impact on knowledge and outcomes and practice. All focus groups were audio recorded, transcribed, and analysed thematically. The training was designed to be studied over a 6-month period via distance learning with delivery of 3 face-to-face study days to support the learning. Pharmacists were eligible to enroll if they were practicing community pharmacists working at least 15 hours per week in the areas covered by the LPCs. The training covered clinical pharmacy management, so health policy, healthcare organisation and management, audit techniques, clinical governance and how it relates to pharmaceutical services, including training and auditing to drive service enhancement, risk management in terms of causes, theory, and investigation of medication errors, service operation and delivery, so service improvement, models of pharmacy practice, quality management theory, and performance. We asked pharmacists to critically review the provision of a chosen pharmaceutical service using quality management and formal QI methods introduced in the training. For example, using root cause as an analytical tools. Pharmacists appraised the strengths and weaknesses of the current service and devised a proposal to enable the service to be enhanced and planned the assessment or re-audit of the improved service. 6 focus groups were held involving 21 community pharmacists. 4 worked for independent pharmacies and the others for chain or multiples. These coincided with the first and last face-to-face study days. Three main themes emerged from the data. The first theme was pharmacists' motivation to undertake the learning. Participants reported a variety of reasons for enrolling on the module, including opportunities for networking, learning from others, developing transferable skills, and ensuring they were up to date with healthcare advances, while others emphasised wanting to challenge themselves, enhance their employability, particularly in light of younger, newly qualified pharmacists who are perceived to be more skilled than themselves. The partnership between De Montfort University and local pharmaceutical committees signalled a vote of confidence that gave pharmacists reassurance to sign up for the training. The second theme were the reported challenges faced when undertaking and implementing the learning. Some found returning to academia challenging and reported a lack of time to undertake the learning, but there was a consensus that peer support was important. There was apprehension at the prospect of having to accommodate the new learning and the potential to interrupt their practice responsibilities and their work-life balance. There was a perceived lack of organisational support. There were instances where participants did not feel fully supported by their managers due to worries over how the extra learning would negatively impact on existing duties. Despite these challenges, all participants enjoyed learning about QI and felt empowered through their knowledge of QI tools. The final theme describes the impact on practice. It was not surprising that pharmacists' prior conceptual knowledge of QI was lacking and its application in practice ineffectual. On completion of the training, pharmacists' knowledge and comprehension of QI appeared to improve, and they were able to demonstrate the application of QI principles to their chosen service. So, despite the challenges, pharmacists did demonstrate an enhanced understanding of QI, were more analytical in their day-to-day problem solving, and view the learning as having a positive impact on their team's organizational culture, with potential to improve service quality for patients. Interestingly, they were proactive in involving their team through mapping and redesigning processes, which appeared to be changing their pharmacy's culture. Pharmacists suggested that it was too early to assess impact on patient experiences and outcomes, since their proposed changes required time to embed in practice. There was evidence that the training had developed pharmacists to be more reflective in their practice, and there was recognition of organizational constraints which limited the ability to fully implement QI approaches. The findings showed that the training we had implemented had a positive impact, and despite the barriers, there were significant improvements in comprehension and application in practice. Pharmacists demonstrated improved knowledge of QI methods and reported using these approaches with their teams to improve practice. These findings add to the growing literature on QI which is needed, particularly in community pharmacy. Despite QI forming an important part of the National Health Service quality and safety agenda, policy initiatives have so far failed to effectively translate QI into routine practice. Key features involve developing cultures committed to the process, an investment in appropriate resources and training, and an openness to learn from others, with an expectation on pharmacists to extend their roles further, especially in light of the significant changes in practice as a result of the COVID-19 pandemic. Educators and policymakers should review how QI is being framed and prioritized within advanced pharmacy education and training, and we are happy to share our findings with anyone who is interested in taking this further. Just a note on limitation. The views expressed may not be representative of all pharmacists, but rather those who are keener or motivated to engage, and it is uncertain whether data saturation was reached. Further research should be undertaken to assess the impact of QI training on service quality, patient outcomes, and if practice change is sustained in the long term. QI should be a continuous process involving a range of stakeholders, but our study suggested not all pharmacists felt supported by their management teams, particularly when they were wanting to trial new ideas, suggesting that organizational value of the process and advantages of using QI may be lacking. Educators should explore more collaborative approaches to upskill pharmacists and help them acquire skills to accommodate new working practices. It will be prudent to embed QI within new roles and services and ensure additional resource is available for training and development. This research is timely since there is a pressing need to effectively promote QI skills to deliver change, ensure quality, and transform services. Creative solutions are required in a dynamic and complex healthcare system. Pharmacists have always been great problem solvers and should be reminded of their unique skill set and service they provide to the community. Barriers to learning and implementation in practice should be removed. Investing in the continued education and training of pharmacists must be valued and coincide with the initiation of new services and practices to enhance clinical decision-making, interprofessional working, service provision, and improvements in patient care. I would like to acknowledge the other members of the research team and to thank all the community pharmacists who took part in the study. Thank you for listening, and please do get in touch if you'd like to find out more.